Thank you very much, David, for that very illuminating view of what's going on in your region. We now come to the round table and the discussion, and I'm joined here by Christoph Boesecke and Coll. And well, I'd just like to say thank you very much for your talks. They're really interesting. And Pep, maybe I could just come to you first, and before we get some more questions that come up, just ask you about what are the biggest challenges to you having a real comprehensive coverage for PrEP in Barcelona, say, and then maybe you can expand that out to Europe.
Well, right now the most important challenge is to get enough resources for fully implementing PrEP, because right now there are many people demanding for PrEP, so we have a waiting list of people waiting for PrEP. But yeah, not enough resources. PrEP was approved in Spain last November last year, and there are additional resources for the drug, but not for the cost of service. So yeah, this is a big barrier.
So this, the resource issue, that's pretty widespread, do you think, across Europe?
Yeah, I think so, and well, it depends in the country, I guess, no. But for instance, in Italy, they have to pay; it's not reimbursed. So in that case, the problem, that the barrier is the cost, no, because some people cannot afford for that cost. So they don't need additional resources from the national health system, but they need additional resources from the PrEP user. So it's the same; the additional resources are needed.
And do you think there are enough people providing PrEP? Do you think that the clinics, the hospitals, the places where PrEP's provided, there are enough staff trained in delivering PrEP and monitoring patients, or do you think we should have more of that?
Yeah, of course. Yeah, we should have. And now, because of the COVID-19 situation, many HIV clinics or units they say, oh, listen, we cannot right now implement PrEP because we are absolutely overwhelmed. And yeah, in this situation, I can understand that. But in the meantime, people are becoming infected, and we cannot put HIV prevention aside because it's
I know it's important. So Christoph, the impact of COVID, you mentioned a little about that. Could you just expand a bit more onto what's happened?
I think it's a mixture. So on the one side, patients are less intrinsically motivated to go to a public health or medical setting to ask for PrEP because they might be afraid that there are people who are sneezing, coughing, or whatever else, or they think that at the moment the services are just not in place or are just not up and running. And on the other side, if PrEP is delivered hospital-based, it's the case in Bonn, then services have to be reallocated. So for instance, staff from my unit, including myself, we had to do COVID patient care rather than, keep up with our HIV clinic and then in addition, put people on PrEP.
So there's quite a stress on the system to maintain what you had before. Did you see that there was a drop in the uptake?
Yeah. So we saw if you compare to the quarter of last year, it's probably a decrease in 25 to 30% of people coming and asking newly for PrEP. And if we compare that to the numbers we now have, they are not official yet, so we see a new peak. So once the lockdown was over, people sort of came out of their shelves and homes or wherever they were locked and asking for PrEP. But on the other hand, even in lockdown, the internet works, so people were still able, of course, to get into contact and even physically. At least in Germany, the lockdown was not strict, so people were still allowed to go outside and run their errands and do other things as well. And I would assume that there will probably a bunch of HIV infections that could have been prevented just if people were kept on PrEP. Some of them just stopped taking PrEP or were newly put on PrEP.
So during COVID, we were delivering HIV drugs to HIV patients. Do you know if there were any facilities for delivering PrEP to patients who wanted PrEP?
No, this system with the drugs, at least in Germany, is different. So people get a small sheet of paper, the prescription, and then they go to any pharmacy they want. So we don't have any hospital-based pharmacies that cater for outpatients.
Okay.
So they have to do it themselves. What we did is, we offered all of our HIV patients, we're very happy to send you the prescription, and then you just pick up the drugs at your local pharmacy to keep them on treatment. But of course, if you want to newly start PrEP, you need to do an HIV test, so you need some sort of physical contact, and otherwise you can't start. The ones who wanted to stay on PrEP, that were already enrolled in the PrEP program last year, they of course also were sent their prescription to keep them on pills if they wanted, but a lot of them didn't get in contact, so they just decided by themselves to stop taking PrEP because they thought there might not be any risky contacts throughout the calmer lockdown season, and then sort of restarted even without doing the HIV tests and without doing kidney evaluations, etc. And then at some point they just pop up here because they ran out of the last bottle. And then at least the physician gets sweaty hands because they have been on PrEP for 4 weeks, but they were off for 12 weeks, and God knows what happened. And you can just pray that the HIV test turns out negative.
Yeah, it's difficult. So
we did it in Barcelona at a point. We did it, and we set up a delivery system for drugs and also for HIV self-test, because as Christoph said, it's not only providing the PrEP, no. And we're thinking that maybe we'll have to keep on using this system, because the situation, maybe we can have another lockdown situation, and people we know that lockdown doesn't mean sexual abstinence, sure.
No,
so
for sure.
We have to be creative and to think about solutions for ensuring that people who keep on needing PrEP can have access to that.
Yeah, well, that's it's a really good system if you can put it in place. There's a question from Robert Hedjak. Thank you, Robert, about trying to move PrEP away from basically mainstream clinics and hospitals into pharmacies, communities, community doctors, community centers, etc. There's not that much going on of that sort of movement that I've heard about, but I don't know if either of you want to comment on moving so that PrEP is like we have Viagra over the counter now. I mean, PrEP almost over the counter.
Well, we know that people prefer the community center, or even primary care for getting PrEP rather than hospitals. There is a study, the FLASH study, 85% of PrEP users or candidates said for them the best place is the community center. So we know that it's easy to understand, no? Because they are not patients, they are just healthy people. They feel much more comfortable. Most of them are MSM and transgender women, and they feel much more comfortable in a more friendly environment than a hospital.
Is there much movement in Germany for this, Christoph?
Well, not really, because it's probably the infrastructure that is sort of against it. So we don't have any sexual health clinics per se, as do the Netherlands or other Central European places where they already do PrEP care. So it's very much in the hand of the HIV clinicians, and HIV medicine is mainly done in the private sector in Germany. So there's a lot of dedicated GPs who have been doing HIV since the 80s, and they are of course also enrolling into the PrEP programs. But a non-HIV primary care physician would, I think, be very hesitant. Number one, they are heavily overcrowded, so they're not really looking forward to get 500 new patients who come at least 4 times a year. And then I think HIV is still a bit different. So there's a lot at stake. So if you forget the HIV test at week 4 and you treat an unknown HIV infection with 2 NRTIs, so there's a lot to ruin. So there needs to be, I agree with Pep. And also the environment is different. We have a lot of our patients, particularly from Africa, who like to do all their GP stuff at our place because they would just go to their GP, get their referral letter, and that's it, full stop. So they just end up at the front desk. They don't even see the doctor. And that's fine for them because the environment is completely different. It's language barrier. It's talking about HIV and AIDS, which is a huge stigma in Africa. It's it's still a death certificate written on your forehead if you talk about AIDS. So we have to check that other non-African patients are not in the same waiting area. So it's still today, it's a very tricky and different business than running a hypertension clinic.
Yeah, Pep, I was thinking that for the patients who are in this middle of this COVID situation, you could say to them, well, why don't you've got 3 months of daily PrEP? Why don't you take it on demand? Because your use will probably halve and it'll last you a much longer period of time. And I just thought as a practical thing to try and promote on-demand PrEP. And I saw that David said in their guidelines they only have daily PrEP. They don't have on demand, so it might be difficult for some countries. But I'm sure you and Christoph, your countries have on demand PrEP. Do you think that might be a way around some of the problems we got with providing PrEP?
Yeah, I think so, sure. And because we know that that many people have reduced the number of sex partners, and so of course if they could be on the on-demand PrEP, and also some. It was one of the because the visits could be even every 6 months. I think that we don't need to do a visit every 3 months. So as long as we have a system to monitor that person, no. But that would be a good option, and some people probably could change now, could shift to the on-demand PrEP during this period, because it's true now. They usually, many PrEP users tell me, I have less sex now and less partners. Yeah, so yeah, we have to adapt to this situation.
Yeah, okay. And it's allowed in Germany, Christoph, on-demand PrEP?
Well, only on an individual basis. So I recommend all my patients to do it on a daily basis to get used to the idea, because they're young MSM, they don't take any pills at all. So just to get the idea in their head, you have to take a pill to avoid a certain disease. And then if they say I only have 3 events, Berlin in spring, Gran Canaria in November, and something in between in summer when the lockdown is over for 8 weeks, then that's of course fine to do, but you have to keep them in contact with for the STD management. So home testing, I think, it would be a huge area here in the PrEP implementation. I don't need to see them 4 times a year, as long as I'm sure that they do their syphilis test with a huge rate of syphilis at the moment, and HIV tests, etc.
Okay, well, that was a great conversation. Thank you both for your talks and for joining in the round table, and good luck with all the work on PrEP. And we hope that the COVID epidemic isn't going to erode into our big efforts that we're trying to do to prevent HIV. Thank you so much.
Thank you very much.
Thank you.
I'm now going to come to the end of the I'm just going to get on this, sorry. The end of the program now for this European HIV Clinical Forum of 2020. And I'd really like to thank everybody for listening in. And of course, our wonderful faculty, you can see them all here in glorious color. And so it's a virtual clap to them all that we have to give. But thank you so much. I'd also like to thank our support that we had from ViiV Healthcare. Of course, weren't involved in the program or content at all, but were sponsors of this meeting. So thank you so much, ViiV Healthcare. And for you who have been listening, you may have missed something, but don't worry, the materials will come. I'm going to get onto that in a second. But before that, you can get CME credits for this, and so you just have to apply for that. And you will get a meeting survey, which will be sent to you by email on Thursday, and then a certificate of attendance once you've done the survey will be provided to you after the completion. And as I say, to supplement all of this, you will be able to gain the materials from the website, the www.academicmedicaleducation.com, and you'll be able to get the Endurance materials from there. They'll be posted shortly, so don't just click on it now and expect it to come. It will be in a little while. I also would like to say you can connect with us on social media. So there's a lot of things there: LinkedIn, Twitter, Facebook, all of the things that you guys use, and that helps you for the updates and the news and more. And finally, I'd just like to say thank you very much indeed. Without you and all the interesting questions, we wouldn't have had such a successful meeting. And please fill in the survey so we know what to do next time. And I'd like to wish you good morning, good afternoon, good night. And again, thank you for attending. Bye.